Okay, we are going to go ahead and get started with our webinar. Welcome everyone to another in our series of webinars about the impact of COVID-19 and the current recession on Maryland. Today's webinar is on particularly the experiences of working Marylanders during a time of historic unemployment. For those of you who don't know, my name is Benjamin Orr. I'm the founder and executive director of the Maryland Center on Economic Policy. And we are a nonprofit, nonpartisan think tank that believes that all Marylanders should be able to achieve their full potential in a healthy economy that offers a widely shared and rising standard of living. As we're all aware, protecting public health because of the coronavirus pandemic required some abrupt changes to the way we work and interact. For our part, the Maryland Center on Economic Policy has been operating, working from home since mid-March. But hundreds of thousands of other Marylanders find themselves newly out of work, and the rapid rise in unemployment is unlike anything we've seen in prior recessions. At the same time, thousands of others are continuing to work in rapidly changing conditions in healthcare, agriculture, retail, and service industry jobs, facing greater health risks to keep our communities functioning. Because of the underlying inequities in our system that existed well before the pandemic hit, we know that the risks and the economic pain of this moment are not shared equally. Most of the jobs lost have been in industries that were already some of the lowest paying, meaning many of those out of work were already living paycheck to paycheck. And Black and Brown Marylanders are disproportionately affected, as well as women. We are glad to have two great speakers today to dig into these issues a little further. First, we're going to hear from William Rogers, a professor of public policy and chief economist at the Heldrick Center for Workforce Development at Rutgers University. He previously served as the chief economist for the U.S. Department of Labor and was a member of President Obama's transition team for that department. Dr. Rogers has been closely tracking the unemployment metrics and documenting the disproportionate impact this crisis is having on Black and Latinx people and women. Then we'll hear from Samuel Epps, political director for Unite Here Local 25, which has seen a huge numbers of its members suddenly out of work. He will focus on what the current economic reality means for working people across the state. We will leave time at the end for your questions, which you can submit at any time through the YouTube comment section. And with that, I will hand it over to Bill. Thank you. Bill, I think we need to unmute you.
Yep.
There we go.
So we'll start again. Benjamin, thank you for having me participate in this really important conversation. We thought, okay, why would you have a New Jersey economist come talk about Maryland issues? Well, I have some very, very personal connections to Maryland. My middle son is a recent graduate at McDaniel College, and I serve on the board there. And he actually just started his new job in the district, but he's living in Silver Springs. So I have been actually, for personal reasons, been following what's been going on in Maryland a bit. I'd like to give you a little bit of an outline or a preview of what I'm going to talk about. So if we could go to the next slide, great. What I first want to do is talk a little bit about, the impact of the virus on American families and their communities. We'll discuss some of the immediate impacts, and then we'll also get into some of the longer term impacts. I'm going to try to move through that pretty quickly so we can really get deeper into the conversation around the efforts to provide relief for families and communities, the efforts to provide recovery assistance, and then what we're calling it in New Jersey, where I serve on Governor Murphy's commission for restarting and reopening. And that is, we want to reimagine what prosperity looks like. Similar to New Jersey, Maryland does have a wide income distribution. There are large families who are doing quite well, and then there are also families who are having inconsistently and structurally have been having challenges. And so I want to get us to talk about, share some thoughts on those issues. Just some touchstone points with regards to this relief, recovery, and reimagining prosperity. One of the important things, and it's similar for Maryland as in New Jersey, families were actually much weaker going into the COVID-19 crisis than some of our elected officials, in particular the president, would make it out to believe that we had this amazing unemployment rate. But for those who understand and have studied this concept called ALICE that some of my colleagues and I helped to develop in United Way of Northern New Jersey, we're going to show you a slide or some evidence that suggests that even though we had this great period of prosperity, we actually saw an increase in the share of ALICE households, and it has happened in Maryland too. Another concern I want to raise, we'll talk about, is this that's almost June. It's basically June now, and the end of July, we're going to start to see some of the relief efforts fade away, and so we need to be thinking about now what we're going to be doing or how we're going to support families in their communities. And then third, talk a little bit about how science really has to continue to take the lead on, now all the states are reopened, but even the restarting, even the sort of pace of moving from the various stages of being open, science still has to be at the core, informing those policy decisions. And then fourth, we must reform and reimagine the economy. So let's get started. What I first want to show you are just a few slides about the unemployment and conditions in Maryland and also the U.S. This slide just shows you what happened with the pattern of initial UI claims that basically the week after the March 14th, we began to see a massive acceleration. And so I believe the cumulative number of so you have several hundred thousand cumulative increase in claims, and they have been, and it's similar at the national level and also in New Jersey and other states. We have begun to see a decline. However, those numbers of people still applying for UI are still very, very elevated, and as you can see, still much higher than what we typically have in months prior to the virus coming. Next slide. And this is a slide that's just showing you from January through April. That's the latest set of unemployment rates that we have calculated by the Bureau of Labor Statistics. And it shows you that the pretty picture in January, February, and March, very, very low unemployment rates, historically low at the national level and at the state level. But then April, we got the wallop, right? That the US number jumped about 15%. And then Maryland's number estimated jumped about 10%. Many economists think these are low estimates. One, for example, is if you take into account those who are working part-time, but they want to work full-time, or those who lost their jobs, but if offered a job, they take it. That 15% is actually it came out to be about 23% in that jobs report. And so I would expect a similar number for Maryland. So instead of 10%, the quote unquote real unemployment rate could possibly be around or be in the low teens or high teens or low 20s. Then it just provides you a comparison to those far right columns of what it took us several years to get to in the Great Recession, a 9.5% unemployment rate and a 7% unemployment rate for Maryland. Right, we did that in 1 month. Right? We did that in 1 month. And so because of the challenges with the unemployment rate, and I'm not saying it's a wrong or it's incorrectly done, it just doesn't, in this time of COVID, it doesn't capture the full picture. The next slide I want to show you, I think, does a better job of that, and that is using what labor economists call the employment population ratio. And that is basically, we take the civilian population, so that's going to exclude people in the military, it's going to exclude people incarcerated, and we're going to compare that to the number of people who have a job. Right? So this statistic or this measure captures not only unemployment, but it also captures this fact that some people in the survey said, I'm not searching for a job because there are no jobs, right? We shut the economy down. So this is, I think, a better indicator for us to look at. And so what it tells a similar story, but it's even more striking, right? That in March, 67% of Maryland's civilian population was working. In a month later, that fell to about 58%. Again, well below what it took us several years to get to with the Great Recession. And then even if we talk about what's called the jobless recovery, that after the recession was formally designated as ending, if you recall, at that time in early February of 2010, we were still not adding jobs. The national income was growing, but not at fast enough pace for employers to want to bring people on. So those are two benchmark numbers for you, just to give you the severity of things, which we have, I think, many personal connections, so we know how severe things are. So next slide, please. So who is bearing the brunt of the downturn? I wrote a piece in what's called The Conversation a couple months ago that examined, that took on this question. And as Benjamin said, if we can go to the next slide, what we find is a similar type of experience with economic downturns, that women and minority men have been bearing the brunt of this downturn, particularly because of the dramatic shutdown. Like at the national level, was it 7 million jobs in the leisure and hospitality industry just went away in one run. And so this chart reflects that, where you'll see, and this is for the national level, where you'll see Black men, they started out in March of 2020 with a 60% employment population ratio, falls to 51%, again, well below the Great Recession peak. Even Latino men and Asian men they started at higher levels, but they had big drops. But uniformly, we see white women, Black women, Latino women have much lower. They've had bigger falls and have much lower participation. As my colleague, who's the president of Institute for Women's Policy Research, has said, this is an example of support her view that we're in a she session, not a she shed, but a she session, and this is bearing that out. The next slide, please. Also, people who have less education have been bearing the brunt. This is a two-panel chart showing you this employment population ratio for high school graduates and college graduates. Now, regardless of education, or regardless of race, if you have no more than a high school degree, your participation is lower and you've had a bigger drop. But we still do see, and some of those racial and ethnic contours do go away. That if you're on the lower set of rungs of the job ladder, you have problems. Next slide, please. So why the disparate impacts? We'll just go through this real quickly. We know the U.S., we lost 20 million jobs in that 1 month. In Maryland, it was about 350,000 total. And then when we look at the industries where those jobs were lost, these are industries where women and minority men are highly concentrated: leisure, hospitality, education, health services, and retail trade. Next slide. So let's talk about the longer term impacts. We've gotten into this a bit now, and I think a month or two ago, we probably could have said that we don't want to look in the crystal ball, we just don't know enough. But the sense is, I think we can and we should start talking about some longer term impacts. One is the big question of, is this going to be a V-shaped recovery, that is sharp downturn, quick recovery, or is it going to be what many people call the Nike swoosh? And I think the growing consensus amongst economists, and whether it be the national level, New Jersey or Maryland, that we're going to see the Nike swoosh. And why is that? One, this is all about rebuilding consumption, and hence that one of the most important parts of that is going to be confidence. And that confidence is going to recover slowly. Why? One, because people are behind the 8 ball in terms of they've had losses of income, and they're going into this economy with levels of debt, not a lot of disposable income. There's that one statistic that the Federal Reserve has published over the years, that 40% of American households could not pay an unexpected bill of $400. That was going into this downturn. Also, we're going to see, I think, particularly the smaller employers, the mom and pop mainstream employers, right? Their safety improvements are going to be, I think, slower and lumpier. I know here in New Jersey, with the panel I'm working with, we're hearing that many want some guidance on how to make their workplaces safe, how to provide their goods in a safe and healthy way. The second is, and this is starting to maybe look more on a crystal ball, but it really is looking forward that we're going to see, I think, some structural change, right, in terms of how we work, where we work, when we work, and with whom we work, because of the virus and because that even in stage 2 and stage 3 in New Jersey for us moving forward, we're at stage 1 now, but there will still be an important set of practices, new practices around physical or social distancing. We're going to see new jobs created. So there's going to be an increase in demand for community health workers to participate in the tracing efforts that have to happen. We saw prior to the pandemic, AI and robots were being utilized. I think you're going to see some occupations that had the highest risk of being infected as a worker. Those may, and they're low paid, they may have greater chances of automation. And so some of these could be nurses, personal care aides, medical assistants, OTs, correctional officers, physical therapists, possibly. And as I just said, even in stage 2 and 3, PPE and social distancing will become a new normal. That will have to be practiced in the workplace. And we have continued use of expansion and the expansion of teleworking and telecommuting for those, right? That I think some of the large companies who are trying to figure out how they're going to reconfigure their workplaces or how they do work, right? They're probably going to be letting have people work at home for part of the week, and then come in when they have meetings or they have an A and a B type schedule. That's some of the things I've been hearing. We may also see less business and conference travel. That initially a lot of the contacts and conversations could be virtual, right, as we're doing this today. Next slide, please. So let's shift to what was a phrase partly used during the Great Depression, that was relief, recovery, and we're going to use the word reimagining and reimagining prosperity. This is where we're starting to move. I think we want to have the discussion, and if we're going to address some of the long-standing inequalities and structural gaps in people's lives, that we need to start having this conversation now before those decisions on how we're going to on how policies are for reforming and reimagining get implemented. So next slide, please. And to do that, I want to tell a story. I want to do it in the context of this household we call Alice in New Jersey, where Alice stands for Asset Limited, Income Constrained, and Employed. And the beauty about Alice is that it not only talks about or takes into account people who are, by the government definition of poverty, it also takes into account households who are above poverty, but they don't have enough income or resources to cover their cost of what it means to live in their community. So it's another way of thinking about the living wage. And when you do that, you get a very different set of stories. You get that in Maryland, almost 40% of households are Alice. The highest is Somerset County. Baltimore County has 40%, Allegheny County has 52%, and the lowest is Howard County. We have a tremendous dispersion like that in New Jersey. So what does that mean? It means that really, these are families. If you're a single person, you need about $25,000, $30,000 just to make ends meet. If you're a family of 4 with young children, you need up to about $70,000. So we've moved up into the income scale, and this is not people going to Disney each year. Right? These are families who just are barely getting by, and they're that family that if they had an unexpected bill, they'd have challenge paying it. Next slide, please. And this is what I was referring to earlier, that you would expect, right, as the economy got better, 7.7% unemployment rate down to 3.9%, we would have expected the share of Alice households to fall, right, as the prosperity, but in actuality, similar to New Jersey, we saw a dramatic increase. And this is the point that, right, that people were projected or thinking that, oh yeah, we got a real low unemployment rate, so best prosperity, families are great, but we have a large fraction, a non-trivial fraction of our households that went into this COVID crisis in very vulnerable positions. Next slide, please. And one of the things that's also so important as we move the conversation forward is we can talk about the impact of Alice being homeless, or Alice not having childcare, or Alice not having enough food, or Alice not having access to transportation, safe and healthy transportation, or not having health insurance, and we can quickly talk about the challenges of the impact that'll have on Alice. But I think as we move this conversation forward to ensure, to raise the odds that we can really have some structural change and really help families out and reduce some of the inequality, or a lot of the inequality we've been seeing or witnessing has been growing, we have to focus on that second column when we have our conversations. That if Alice is hurting impacts everyone. It impacts everyone. So for example, if Alice is not getting paid, has no wages, that's at the bottom there, that's she's less productive in society, could mean higher taxes to fill the gap. Right? There's that we need to really help people connect these dots and who are more fortunate and maybe have not been hurt as much. But that and now COVID-19 really magnifies the impacts on Alice, but it's going to magnify the impact on everyone if we don't choose to help families, not just today or in the next few months or next year, but 5 or 10 years from now. This is a generational fix that we're going to have to do. So, next slide, please. All right. Just a quick comment here about my concerns that states may have reopened too soon and are moving too quickly. I have some research that's going to be published probably in the next week or so that really shows that the decisions to open early, it was purely political. That states that have either Republican governors and or the party affiliation leans or is dominant Republican, they were the ones who are more likely to reopen. And actually the health measures and the economic measures that I introduced in the model really don't explain much. It's been purely political. We need to get out of that. That this virus does not distinguish between whether you're a Democrat or Republican or whether you live in the North or South. I see we reopen too soon because many states and areas don't have the contract tracing and other tools needed in place to really to be able to move forward. Because we're already starting to see some spikes in 16 states that have been occurring. And then by doing this, we've just put Alice, we talked about this good game of, wow, oh my gosh, we're seeing Alice, or we're seeing families they're on the front lines helping people, but they also have the economic challenges. Well, we're now, by opening too early, we're putting Alice in major risk, especially if we don't have the supports there. So these are childcare workers, home health aides, orderlies, nurses, and medical supports of needing to get a check. But that's where policy has to come into play and provide that bridge to the recovery. Next slide, please. So what does Alice need? Well, Alice needs the HERO Act plus more. In terms of housing, what's in the HEROES Act, we need emergency assistance for renters and homeowners. We need childcare. That's been a major conversation piece as a part of our commission conversation. Is that families need, and so we're moving into the summer. It's no longer schools. It's going to be day camps or camps, and those are going to need help and assistance with providing a safe environment. The HEROES Act boosts funding for nutrition assistance through SNAP and child nutrition programs. Next slide. There's a variety of items in the healthcare. I'm not going to go into them, but we can talk about them maybe in the conversation, or Samuel will talk about them. Next slide, please. And then what I've been focusing a lot on in my writing has been on the income supports. The unemployment benefits should be extended until the job rate returns to normal levels. You can use some triggers. We need to provide another stimulus, or I don't want to call it stimulus, I'm not stuck in there, but a rescue package or rescue check or payment per person. I like the idea of increasing or making the employee retention tax credit even more supportive. And also extending the $600 per week through January 31st. We may have to extend that even longer, but next slide. And most important, really, Alice, and we're doing those policies or those responses, what that's doing is providing Alice with more assurances, because this is about confidence. This is about people reducing their fear, reducing their anxiety, and feeling that they can either work in a safe place and or shop in a safe place. So as I said, Alice needs the HEROES Act. We need child care facilities and day camps. They need the guidance on how to create safe spaces. Small businesses need guidelines, education, and resources on how to create safe spaces. We may even have to use, maybe we want to even use some of the community resource or health resources individuals to be those conduits and helping those small businesses move things in that positive direction to where they can be certified or can promote to say, yeah, we are practicing good, safe social distancing and business practices. Then the other is also safe modes of transportation. This comes from the latest example. This for me comes from a conversation in our commission that the New York Penn is jam packed has lots of riders, 5:30 to 7:30 now, and they're largely been driven by the governor opening up construction back in the city. And so what's happening is these are a whole host of construction workers that live on the outer boroughs that they're not going to drive in, but they're taking the subway in or the train in, commuter train in. And so it's a challenge when you're trying to create policy or make change in a crisis because you end up not seeing unintended, you end up having unintended consequences. But as long as we're communicating and dialoguing like we are today, I think we have a really good shot at that. And so my last slide is a concern that on reimagining how we want Alice to live. There are some headwinds that she's facing. The Senate Republicans and the president have said the HEROES Act is dead on arrival. I hope that was just their initial stance on negotiating, and that they realize that they're going to have to that's not tenable or sustainable. But to get them to move off is that we need to do the following. From my old school board days, develop a budget of need. We need to really articulate, this is how we reimagine we want Alice to be able to live. And then we have a conversation about how to fund it, as opposed to saying, we can't fund it, we can't afford it. Because I think that's a potential problem we're going to have as we get into the reimagining conversations, where people have been saying, I want to address long-term inequality, but oh my gosh, we have a massive budget deficit and we can't afford it. But so if we set the target and have a conversation about how we want people to live, I think that can raise the odds that we can get there. We also have to really create a business narrative that investing in Alice helps the bottom line, that if Alice hurts, we all hurt. And it's incumbent that each of us gives Alice a voices and shares her challenges. And why? Because our investments in Alice will determine the pace of recovery and whether our future prosperity is a shared prosperity. So thank you. Let me stop there.
Thank you, Bill. That was a great and very informative presentation, and I definitely wrote down some questions I may use my moderator prerogative to ask later. Now I'd like to invite Sam to share some thoughts on what these numbers really look like in terms of working people trying to make ends meet. Sam?
Thank you, Ben, and thank you for the invitation and to the Maryland Center on Economic Policy. Thank you for your continued work on looking into how we have working families in Maryland prosper and have a living wage and all those things that Dr. Rogers has just talked about. And so his presentation, as I looked over it and reviewed it, is spot on. Our union is a 7,500 member union that represents hospitality workers in 3 jurisdictions, Maryland, DC, and Virginia. We have about 2,500 of those members who are on the National Harbor platform in Prince George's County. And so, to give you some real life anecdotal and experienced look into what this has done to members and workers, not only to our union, but even non-working workers in the state of Maryland. Pre-COVID-19, our workers were preparing to come off what they consider a normal slow period. That January, February in hospitality is a slow period. So many of our workers begin to use their personal time, their vacation time. That's when they go. Their Super Bowl, as we call it, is the spring. Is in March. Is in April, May, June. The cherry blossom. School children coming down on their class trips. Hotel and leisure conferences are going on in all three of our jurisdictions. I think we were first hit, and as we say, we are a leading indicator of the economy and also a lagging indicator. And as Dr. Rogers has said, we believe our industry will be the last to come back. And so that means that there needs to be an extended help for these workers, because some of these workers were already out on unemployment December, January, and February, and they've already began to use up their unemployment requirements. And so, as we get to 10 days before the stay-at-home order for many states here in Maryland and stuff like that, 1,000 of our workers were laid off at the Gaylord National Harbor. So that uptick that you saw in the chart that Dr. Rogers put there, some of our members were the first members to be in the unemployment claims, because that's immediately what we did, was to tell our workers through this reimagined work, through our text messaging system that we have with our members, is to apply for unemployment. And so they began to do that. And as I was talking earlier to our moderators, our workers did that. But we have workers today who have not received an unemployment check. The system has absolutely failed them. I was looking at a list of 200 of our workers who are Marylanders who have not received an unemployment check for 6 weeks. And so those are for members who are eligible for unemployment. We have members who are undocumented, who are out of the system, who can't receive unemployment because of federal guidelines. And so we also have to look at those members as well too. And there's workers out there who are excluded workers and who have not been able to access any kind of assistance. And so those assistance come in on the local level. We have governments, Montgomery County, for example, provided undocumented workers with an assistance package. In DC, we see BENT DC, the hospitality arm of the convention center, put in for hospitality workers, restaurant workers, for those who are undocumented on the UI system, they'll be able to receive a cash assistance as well too. Our own union have been passing out grocery cards to members who cannot get unemployment into the unemployment system. And so what we've seen through the Maryland unemployment system is that the system is just absolutely broken. And we've been testifying in all our jurisdictions some of the things that we think needs to happen to move this along. And it is we certainly support and governors around the country, that the federal government has to come in and help fill the state coffers based on the impact that the revenue has had because of the shutdown. So these workers will not be unattended to, and their basic needs of being able to get food, pay rent, and also to be able to have to be able to communicate. Well, I think what we've learned through this pandemic is everyone doesn't have a computer or internet access, and so their telephone is their only mode of communication. And that's why we have a text messaging program going on with members. And so, and many of these unemployment systems need to make their systems not just online, but it's mobile friendly, that it's optimized to be done on the mobile, because phones are probably the only way that people communicate, and they can do it right on their phone. And some of the jurisdictions, they can't do that. They have to go to a neighbor, get their niece to do their unemployment. We are also, as we're in these stages of recovery now, we are beginning to look at PPE, how we do the work. What we know and what we've heard in our own industry, that there's hotels who, what we call mothball, who basically have just shut down. And some of them will not open up to July 1, August 1, September 1, right? And then when they open up September 1, the occupancy will be around 30%. So that means that all workers who are in hospitality will not be going back to work. Why would a Marriott bring 100% of their workers back if only 30% occupancy? They're only going to be 30% of the workers back if that's the occupancy. And that's how our industry works. It works on occupancy. And Dr. Rogers says something very clear: consumer confidence is very key to this recovery. And no one is going to stay in our hotel or any hospitality if they're not safe. If the workers are not safe, no one will come and do that. And we know, as Dr. Rogers has said, conventions will now be doing them, Zoom, Uber conferences. There won't be large gatherings at this moment in time. So it won't create an occupancy, which we rely on in this region for our hospitality, international travel. That will not come back until there's the healthcare crisis is solved. And then I think the last thing, and like I said, I wanted to be brief because I really want to discuss this in detail, is healthcare, which is very important. Our members, they're very lucky. They have a contract. They negotiate healthcare with their employer. But as of May 31st, all 7,500 members of our union will not have healthcare. We were able, when the shutdown happened, to negotiate an additional 60 days. But being that hotels are closed, they have no way to pay the premium. It would cost for a month for our workers is $11.2 million of healthcare premium. We get 100% healthcare, our members. And so to ask an employer to do that when no revenue is coming in has been we're still negotiating, but it's very unlikely. So now we have to move our members where some of the things that Dr. Rogers has said had that exhaustive list. We have 900 of our members who are eligible for Medicare, that we got to get them on Medicare. Members will be applying for Medicaid. They'll be looking at all the Obamacare health exchanges in Maryland, DC, and Virginia. And so healthcare and so not only us, we know that there's workers across the state whose healthcare is tied to their employer. And if their employer is not paying the premium, or they have to go, their share of it goes up, they can't afford to do that. And so we're really looking at healthcare and also protecting our workers as the reopening comes. And so I think the slides and the presentation by Dr. Rogers is spot on. And I'll end there so we can get into some discussions, Ben.
Thank you, and that was great additional context. We are going to open up to questions for the audience. If you'd like to ask a question, type it in the chat of the video stream, and questions will be forwarded to me. As folks are submitting their questions, I'd like to ask you both to share your thoughts about some policy changes that might help protect working families and prevent further damage to the economy. You know, we've talked a lot about how the unemployment system is strained, and people have, you know, Sam, you were talking about how your members have gone weeks without receiving benefits, and Dr. Rogers talked about how, reminded us that, before this crisis, 40% of Americans couldn't afford an unexpected expense of $400 or more. And that just the collision of those two facts is life-threatening if you can't put food on your table, for example. Or I think about the idea that, in Maryland, yes, we have this bump up in unemployment benefits due to some of the federal bills that have been passed that, again, is going to expire at the end of July. But normally, Maryland's maximum benefit is, I think, $430 a week, I believe. And there's nowhere in Maryland where even a single adult without kids can survive on that on less than $620 a week, based on some of these, ALICE or other living wage calculations, the fact that we normally exempt gig workers, things like that. So I'm just curious about your thoughts about where the gaps are, who's left out, and what are some policy changes that we could pursue, particularly at the state level, but state or federal level, that would protect working families and again, prevent further damage to the economy.
Sure. I think the HEROES Act, as passed by the Congress a few weeks ago, it's, dare I say, it's a laundry list, but it really, I think it made an effort to try to go back and identify some of those initial gaps that existed. One of them is there are new college and high school graduates, right, that are going to have difficulty, right, getting jobs, getting employment, and they are not going to meet the eligibility requirements, right, in terms of work history and wages. And so the HEROES Act was good in citing that that group of people. I think the other set of people that we need to also prepare for is helping our state and local workers, right? That there hasn't been a governor, right? Well, let me say it this way. Many governors have been talking over several weeks about the budget deficits that they're going to experience, right? My governor already tipped his hand and says, yeah, we will have to furlough some people and possibly lay off people. So the challenge, right, with the state and local governments, they cannot run a deficit. They don't print money. And so the only way that they can generate revenue is either you raise taxes or the opposite, you cut. And so that federal aid coming to state and local governments is really, really important. I would put that as a huge priority because, you asked me to talk about, right, people who are more adversely impacted. Well, women and minorities have a higher representation in state and local government or public sector jobs. And so if those furloughs and layoffs happen, you will see another spike in terms of black and brown and women's unemployment rates, or falls in those participation numbers I showed you. So those are just a few things.
Yes, I would piggyback on that. We certainly see in Maryland, and many of those workers are represented by Sister Local, and they've been very helpful. They've been doing a yeoman's job with the unemployment system under enormous pressure. But I think I would take government also needs to reimagine, and I hope that in Maryland, the governor would add, not take away, especially in the UI system. The UI and health and human services, those areas that Dr. Rogers has pointed out is going to need longer investment because the recovery is going to be a lot slower. And so I think that's an area, even the human capital, if we look at demographics, who serves there, who works in state and local government, totally agree with that, but they need more individuals there. One of the things that I thought about is there needs to be, some additional jobs to come in to help workers who don't understand government and how this works. And you could have an unemployment navigator, right? It's something prior to them even applying for their unemployment. They have questions. How do I do this? okay, well, here's how you do this. You go online, you do this. Okay, we'll now get that over to the UI specialist. And it may make it a lot more efficient, and people won't be stuck waiting on unemployment when they don't have no food on the table. And so those are some of the things that I think we can do in government to do that. And I know we also have to press the federal government to give state aid to do that. But I hope that our state folks will not furlough just because, but we can think to reimagine this, that, you know, right now in these stages, parks and other things, or something in state government may be closed, move them over to unemployment, move them over to health and human services, to since they're in government already, and redo their work. We certainly did it in our office. Our whole administrative staff is now working on unemployment. Our members are calling, okay, how can we help them? And that's what we have to do now, is to reimagine. So I'll end there and get some more questions.
Sam, maybe I can ask you a related question we had come in here, and that is, what kind of advocacy can everyday people get involved in to press for, I think this is referring specifically to unemployment benefits, to press for the state government to release those checks? You know, I think, I know there was one public hearing where more than 1,000 people signed up to testify. I know you guys were part of that. Or if there's other ways that the general public, our viewers, can contact their local representatives, or there's sort of a second question here too around, like, how are employers responding? Are there ways that people can pressure their own employers to be interacting with the system to help push the state administration to do better at getting the checks out the door? So I'm combining two questions here a little bit, but what can people do to help?
And so I'll give an example of the second question first. I'll answer the second question first. And absolutely, our employers in our industry, there may be tension, you know, because we're a union. There's tension on certain things, but something like this, we've been working pretty much together, right? Our industry has been totally devastated. And for example, Marriott gave a 2-week disaster pay to all their workers, and that includes union, non-union. But that 2-week disaster pay caused a problem in individuals' unemployment, because, you know, our lawyer said report it so they don't have fraud. But it was actually a gift from Marriott. So Marriott had to call the unemployment office in Maryland and say, no, that's not their pay. They're not coming back to work, and they won't be coming back to work. So yes, they're filing their weekly claim, and so you don't take them off. We had a whole bunch of folks at our Marriott, Gaylord in particular, that got that 2-week disaster pay, had already started collecting unemployment, was doing their weekly claim, and then they were cut off because they thought they were back to work. And so it was good that our employers went to unemployment and said, no, this is something else. This is, you know, we're giving this to all employees. This is that disaster pay, because they would have been at work. And so, you know, so yes, employers can be very helpful moving government and working with labor and workers to move joint process. And so that's an example. And then too, I think on the state level with our unemployment, I think you have to call your state rep and the governor. Those are the two places who have a direct impact on the agencies that run the system. And so yes, and work with organizations like yours, Ben. I know you all have been at the forefront of this as well too, around legislative remedies and infrastructure remedies. I think all states, you know, I saw something on NPR, you know, these systems are being run on COBOL, right? I had COBOL when I was in high school, right? And so, you know, we need to get those infrastructures and those capital improvements on these systems and put these systems in the cloud or on another server, that so when there's a surge like this, that it can continue to go. I think Connecticut, I saw, has probably the best UI system because they went to a cloud-based server and they didn't have these problems. So.
Bill, you had something to add?
Yeah, I guess I'll share. I mean, I think I agree totally with Samuel in terms of how our unemployment insurance programs just needs to be overhauled, and this could be that time, needs to be that time to do it. But it also needs to, when you mentioned, and you talked about that in the context of infrastructure, but I think other infrastructure areas that could be used, we could also focus on. And this was a part of one of our conversations at McDaniel with our board, that our staff was interested in wanting to do deferred maintenance, and the rationale there is that, right, when you do have downturns, what are the projects or what are the upgrades, right, that don't get done, and it's your whole your list of capital improvement projects. And so, this is that part of the reform and then reimagining, right? That those are, yes, they may cost you some money, but it's an investment back into the institution, into the community, and then hence you'll have greater returns going forward. So this idea of I think assisting businesses and communities with deferred maintenance, that'll also put us in that position too, where when we want to have that big infrastructure project that or program that has been talked about for the last for the last 4 or 5 years, right, it's not going to be as big. So that's another angle, I think, on your question.
Bill, I wanted to ask you, because like a lot of us here at the Maryland Center on Economic Policy, you live amongst the data, and I think one of the point you made about how the unemployment rate is about 15% right now, 15%, but we really think it's more like 20%. It made me think about, reflect again on this idea that we're probably going to see some data weirdness. And so not everybody's deep in the weeds about how these measures are created or whatever, but I'm just wondering if there is anything in particular that you expect, like, for example, the ALICE indicator, right? Well, the E stands for employed. If we have a whole bunch of people drop out of the ALICE category because they're no longer employed, that will could skew the story in a way that doesn't actually reflect what's actually happening. Is just a reflection of what's happening with the data. And maybe ALICE isn't the best example of it, but I'm just wondering if there are indicators that get talked about a lot in the media that maybe we should expect might be a little funky or might be a little delayed in terms of actually telling us what the true story is. Sure.
So if they fall out, if ALICE falls out of employment, they still will be ALICE, right? Because their incomes will fall, and they're not going to have enough resources, right, to cover what they need. Real quickly, I mean, the obvious statistic that I think we have to be we have to I won't say be wary of, but have it next to a bunch of other indicators, and that's the unemployment rate, the official unemployment rate, for several reasons. One, and what got me into this whole conversation was, right, the survey for which the unemployment rate is estimated, it's done the second week of each month, and then they report it 3 or 4 weeks later. Again, I'm not quibbling with the efficacy of that. That's the process they've been doing it. But when you have weekly claims that all of a sudden jump by 5 million, right, when it's not in the survey week, I mean, that's what we had happen, right? The survey week, there were only a few 100,000 during that March, I believe it was, March. And but then we continued the following weeks, had millions of people filing. So, here's a case where you have to use along with their statistical data, but administrative data is so important, right? How many people, or what's the pattern of usage of food pantries? What's the pattern of people calling on 211 for referrals about I need help with my bills, right? I mean, Samuel's union. I'm sure you all have great information, all right. But that's at least, and it's for your members. But it's still very, very important. And so I think as we move forward, right, we have to, yes, utilize our regular Bureau of Labor Statistics estimates, unemployment rate, plus this indicator I showed you today, the employment population ratio. But we also have to be willing to use administrative data, even though that data is not necessarily meant for, academic or statistical analysis. It's very important. And the other thing that's why it's important, it is something that the labor secretary and my mom, especially my retired social worker, really laid into me was, as you said, I'm knee deep in the numbers, or I'm enmeshed in the numbers. Well, for every number is a person, right? Every number is a person. Yep. Every number represents a life. Every number represents, right, humanity, and we have to keep hold of that. And that's why I showed you that one graphic of here's what happens to Alice if she doesn't have housing. Here's what happens to Alice if she doesn't have health insurance. But I think where we're going to come out of this as a stronger nation, as a stronger set of communities, is if people can live in that second column. That if Alice hurts, I'm hurting, and even if Alice lives in Western Maryland, and I live in Princeton, right? I have to be concerned about that person and be willing to make investments in that person and their community just as much as I would do with mine.
So we are running out of time. We're at the 4 o'clock moment. But I want to thank both of you so much for joining us today for this great conversation, Bill and Sam. And also thanks to everybody who joined us in watching the live stream today. We hope you will stay in touch with the work of the Maryland Center on Economic Policy and the great work that Dr. Rogers is doing out of New Jersey and that Sam and Unite are doing here in Maryland, the DC region. On the Maryland Center on Economic Policy's website, you can find our past webinars and blog posts about the impact of the COVID-19 pandemic and sign up for our email list to find out about future events. You can also follow us on Twitter at MD Economy or on Facebook at MD Economy Policy. MD Economic Policy on Facebook. With that, thank you to you both and have a great day.
Benjamin, thank you. Samuel, thank you.
Thank you.